So my name is Josh Mattila. I'm an assistant professor at the University of Pittsburgh. I work on tuberculosis. And I first heard about COVID probably on Twitter, following some people who are infectious disease experts and people who work on influenza, and started to hear reports about a new respiratory virus coming out of China. And when I heard more about it, I became actually quite concerned that it was something more important than just a standard case of the flu that was going around. Since I was paying attention and I kind of knew, I had the sort of that, I guess, educational experience to know that this could be a significant pandemic. And one of the first things I remember talking about was whether the American Association of Immunologists meeting in that May was going to go on. And I was expressing skepticism, and I was expressing this to a colleague when we were out at dinner. And surely enough, over the next couple of months, things got more and more, and it was sort of like watching a freight train getting ready to crash into a truck. There was a sense that something serious was going to happen. And when the really bad cases started to happen in New York, then all of a sudden I knew that things were going to be very serious here. And my lab, I had a small lab. My lab is still small. And I immediately started to think about how are we going to try to deal with this if, for example, we're not able to go to work for a while. I had no idea what that was actually going to mean, but I had thought about it during the course of the lead up to the pandemic. There was not a lot we could do. So our school closed down, I can't remember the exact date, but it was one of the, as soon as kind of a public health emergency was declared, the university shut down. The day before that, or the weekend before that, there was like the home sport and travel show in Pittsburgh. And so my wife and I went to that, and I had been watching the news. We had all watched the news, and the place was empty. A lot of the vendors had gone home. And I walked through those hallways, and I was really scared, actually. The people would ask me to come on over so they could talk to me about Windows or whatever. And I knew, they're like, this is something I'm really worried about. And so when I went home that night, I told my wife, I have a hard time imagining that things are going to continue to remain open. And sure enough, the university closed that next week. All the students who were on spring break were told not to come back. And the school shut, all of its labs down. We had some experiments that were things that can't be repeated in a very complicated and expensive model. And so we got special permission to finish those experiments up. But it was scary. We went into spaces knowing that we might be in those spaces with other people who are carrying this pathogen that we didn't know anything about and didn't have any experience with. And where people in New York were dying in large numbers. And so my department was headed by people who were veterans of the HIV pandemic and the really dark days of the HIV pandemic, where lots and lots of people were dying of this completely undescribed disease. And so they, I think, did a really good job of preparing us for what might be happening and how we might find a way out of this. And they were very proactive in how to deal with this. But at the same time, I had students who couldn't go back in the lab, students who were at the end of their career and their master's degrees, for example, and their projects were done. They just did not have an opportunity to continue on. I had to find some work for my technician to do, some analyses that she could do sort of while she was at home. But it was a time of real uncertainty. None of us had any idea how we were going to get through, or how long this was going to be, or what it was going to be like when we got to the other end of it.